You ever notice how your health insurance gets more expensive every single year, even in the years you barely get sick? Like you're being punished for staying healthy? Well, it's about to get worse. Much worse. Hey, this is CoinRad, and today we're breaking down why your healthcare costs rise no matter what you do, and why the next big jump isn't a glitch. It's the moment the system finally stops hiding the real price. Let's start with the question everyone asks. Why does my medical bill look like a ransom note? Because in America, healthcare prices are fictional. Not confusing, not complicated, fictional. Two people can get the same test from the same nurse, and one gets charged $130 while the other gets charged $3,000. Not because the care is different, but because the price is. Hospitals keep something called a charge master, basically a list of fantasy prices that make the minibar at a luxury hotel look fair. Nobody actually pays these numbers, except sometimes uninsured people, and sometimes insured people. And sometimes nobody knows what the real price is until your insurer negotiates a discount that may or may not exist. Imagine buying a plane ticket and only learning the price after the flight, with 4 mysterious fees you never agreed to. That's how US healthcare works. And here's the wild part. Even if you avoid the doctor, your costs still rise every year. Because the system doesn't need you to get sick to make money off you. Now let's discuss why your premium rises even when you're healthy. Your premium rises because everyone else's healthcare gets more expensive, even if you personally barely use the system. Someone across town starts Ozempic, your premium goes up. A hospital bumps surgery prices 12%, your premium goes up. Your neighbor has a heart attack, your premium goes up. Insurance spreads risk. But in the US, the risk sits on top of a pricing machine that increases costs every year. Hospitals charge more, drug companies charge more, insurers pass it on, and wages don't keep up. Employers feel it too. That's why your plan quietly gets worse every year. Higher deductibles, thinner networks, higher copays, surprise out-of-network traps. It's like your Spotify subscription doubling because your neighbor listens to too much music. And all this sets the stage for the bomb dropping in 2026. The 2026 premium shock. Here's where everything changes. Millions of Americans are about to see their health insurance premiums jump. Not 10%, not 20%, but 114%. Why? Because the enhanced subsidies created during COVID are set to expire. If Congress does nothing, and right now they're doing nothing, the mask comes off. Insurers say premiums are rising around 18%. But without the subsidies, the amount you actually pay more than doubles. Your premium doesn't rise 18%. Your bill rises 114%. 24 million Americans rely on these subsidies, mostly in southern red states where ACA enrollment exploded. Meaning the people hit hardest are the ones least expecting it. And here's the shocker. Nothing changed in healthcare. Doctors didn't suddenly get more expensive. Hospitals didn't get hit with a secret tax. The system just stopped hiding part of the real price. It was always high, you just weren't seeing it. Now let's look at how the system turns you into a revenue stream. Here's the part nobody wants to think about. Medical debt isn't a failure of the system, it's a business plan. Over 100 million Americans have medical debt. It's the #1 cause of bankruptcy. Not credit cards, not student loans, medical bills. And it works like a shadow tax. Get sick, get billed, fall behind, face collectors, wreck your credit, pay higher interest, lose savings, lose mobility. ER groups bought by private equity intentionally stay out of network so they can charge whatever they want. Ambulances? Many are private companies too, and often out of network even when the hospital is covered. You're not just paying for treatment. You're paying for every middleman in the chain. Billing companies, coding consultants, debt buyers, admin layers, investors. It's extraction dressed up as care, and most of it hits before the bill even reaches you. Now we need to talk about why healthcare will never get cheaper. Here's the truth tying everything together. American healthcare is expensive because it can be. In many areas, your hospital has no competition. Your insurer has no competition. And sometimes the hospital owns the insurer, or the insurer owns the hospital. That means prices aren't prices, they're ransoms. Private equity firms roll up clinics and ERs. Hospital systems buy rivals. Drug companies raise prices because insurance will pay. Insurers raise premiums because employers will accept it. It's a closed loop, and you're the revenue stream that keeps it spinning. The US spends 2 to 4 times more on healthcare than similar countries for worse outcomes. Not because Americans are sicker, not because doctors aren't excellent, but because the system is designed to extract, not optimize. Which brings us back to you. Your costs rise every year not because you're unhealthy, but because the system is. This is CoinRad. Hit subscribe and stick around for more stories about money, markets, and the madness behind them.